Welcome to the Dots and Bridges Thought Leadership Consortium. My name is Pete Saronis, and I am honored here today to be with these esteemed guests who you will meet here in a minute. I am the former Chief Technology Officer for the United States Department of Energy and Education. I am the CEO and founder of Dots and Bridges, which is really about connecting dots, building bridges, and creating some light bulb moments for the audience. And then with these incredible change agents and thought leaders who you will meet today, and some you probably already know, we hope to shed some light and frankly, create that enlightenment, that information, and maybe some knowledge that means something to you. And that topic is COVID-19 and how data and technology and partnerships are so important to curbing this pandemic. The US has made strong progress toward COVID-19. The vaccine itself with multiple candidates, as we know in clinical trials, immunization with a safe and effective COVID-19 vaccine is critical to the United States. The healthcare sector is one of the 16 deemed most critical in our country, and we're feeling that and living that and breathing that today. How we reduce illnesses, hospitalizations, and deaths and restore societal functioning is something we pray for and hope happens sooner rather than later. With that said, I'm going to introduce, and I will not read bios, these amazing individuals, starting with Dr. Este Geraghty, Chief Medical Officer at Esri. Other than being board certified in public health and passionate about technology and educated beyond educated, Este is very passionate about transforming health organizations with a geographical approach, and we'll get into that. We'll use some terms like geospatial information science, but a lot more, and you'll get to understand Este's role, not only at Esri, but in the public health domain. Dr. Don Burke, President at Epistemics, Dean Emeritus, Graduate School of Public Health at the University of Pittsburgh, a fellow with the Infectious Disease Society of America, and an elected member of the National Academy of Medicine. Working with Dr. Burke and his involvement with the national labs and academia and industry and the collaboration with the technology sector is amazing. He's developing computational modeling software solutions for epidemic diseases, among many other things, and we'll hear about his walkabout in life and the impact he's having on the world. And then we have our governors, Jim Geringer and Howard Dean, amazing individuals, former governors and Vermont in the case of Governor Dean and Governor Geringer in Wyoming, both strong advocates for technology in government, industry, and academia. Their focus, personal and professional, on sectors like life sciences and energy and spatial navigation, timing, and things of that nature is unbelievably interesting. And they too know that how the technology, humanity, culture intersection really needs to be continuously evolving and staying in touch with it, not only for themselves, but those that they represent and are part of. So it's an honor to be here today. I'm gonna jump right in because we have a lot to cover, but a lot of key issues to address. And I'm gonna start with Este, if that's okay. You know, Este, one of the topics that you write a lot about, talk a lot about, deal with this not just national, but international vaccination campaign. And at Esri, where you know, the developer of the world's most powerful mapping and analytics platform, how can leaders high level start to think about achieving equitable, speedy vaccine distribution? Because that's a topic we'll be addressing today.
That's a great question, Pete. Thanks for asking it. And I think of the vaccine distribution problem. I mean, just the idea of distribution and getting it from point A to point B clearly indicates it's a spatial geographic problem. And so that's where our company's expertise can really be supportive of the effort. So that first part, getting it from manufacturing to points of distribution, is a supply chain problem, right? And there are a lot of complexities that go along there. And what do you run into as you try to transport from point A to point B in terms of weather and security and other issues? So these are all things that need to be planned that add to the complexity of just getting the vaccine somewhere. Then from there, you have to distribute it, administer it to the population at large. Well, if we're going to end the pandemic as quickly as possible, which I know is what everybody wants, we need to be really careful about the way that we distribute the vaccine, because it's not going to come all at once to everybody. It's going to be in phases and over time. There's a lot to manufacture there. So prioritizing populations based on really specific, useful criteria, like let's take care of our frontline workers, because that not only takes care of a population that's highly exposed, but a population that is supporting our health system infrastructure. So that makes perfect sense to vaccinate them first. And then we have other phases of the population based on who's most likely to suffer severe disease, who else is exposed, like critical workers, and people who are more likely to transmit disease, like in congregate housing situations, prisons, nursing homes, university dormitories. So all of those things are spatial because those populations are not distributed evenly across our communities. They live in different areas, and we can map that and make that allocation of vaccine much more intentional, again, to end the pandemic as quickly as possible. And then the other spatial thing that I think comes into play is that we're going to find there are gaps. You're going to have facilities that receive the vaccine, populations that need the vaccine, and they're not going to match up perfectly. So it's another geographic problem to figure out how do we make sure we can get vaccine to each and every person who is eligible and wants to receive it.
So Este, thank you. And for framing that, I'm going to pivot over here to Dr. Burke, because funding for vaccine distribution, you mentioned supply chain. For those out there, that is the term that we use as, where's the origin and how did it get here? And there's a lot that has to be examined along that way. The logistics, the monitoring, the federal, state, and local authority with vaccine requirements. Dr. Burke, hearing Este and, speaking to a picture's worth 1,000 words, right? Esri is a globally recognized mapping company that is amazing. But powering Esri, or powering the world of Estes with computational modeling, can you talk a little bit about that capability that Fred, which is I'll let you speak to that, at Epistemics is doing to help paint that picture?
Sure. So one of the major problems in every epidemic is being able to understand how the epidemic is moving, both in space and in time. Who's infecting who, where can we expect the epidemic to be, not only in the next day or two, but over the next week or two or more. And then our challenge is to intervene in a way that we can change those trajectories to try to limit the spread. Well, these are really hard problems. They involve all sorts of data that have to be thought about at the same time. There are the underlying social networks of who interacts with who moves across community lines, across county lines, across state lines, where the disease can be transmitted. What are the human behaviors that are changing over time? And importantly, as we're seeing now, what happens as the seasons change as well? And how is that going to affect the overall transmission? Well, trying to put those all together and think about it is really hard. And so I've been working on these kind of problems my whole career, and we realized that we needed computational tools to help us do this thinking, to simulate the processes that I just talked about, to put them all together in a computational way that allows you to then say, well, what happens if we don't have this exactly right? So let's change the scenario a little bit, or change the scenario that way, and think through all of the possibilities over the next coming days or weeks or months. So that's what we did. We developed a tool that allowed us, a computational platform, to simulate every person in the United States and the transmission of disease from person to person over space and time. And so now we're working with Esri to take our modeling data and to be able to look at that, to take their data streams, which are incredible in terms of their informing capability. We put it into the model to see, well, what could happen in the future, and then take it out again and then put it in maps and look and see what these possible futures might be. So we're hoping to provide decision makers with tools to think through these complicated problems.
That's a great point and points, and there's more we'll distill there. And I want to pivot over to the governors. We'll start here with Howard, Governor Dean. We open this with a technology and collaboration partnership that's burgeoning and part of the world we live in. We talk about the Internet of Things and the globally connected world and the sensors and then this and that. But what I like to think about is the platform that you have today, and you and Governor Jim have had, is to the constituency. Why should I care? And what's happening outside of the Beltway? And I think in a world where leveraging data as a strategic asset, real-time information sharing. Can you speak to sort of what would a governor's roadmap be to convey information, but also leverage the opportunity with data and the tools we have today to kind of feel like we've got a good sense of how we can curb this pandemic?
I think both Jim and I have an advantage over many governors, and we're both scientifically trained. Jim's an engineer, I'm a physician. And that what you can do if you're in politics, your gift is to talk about narratives and talk in language that ordinary people can understand. So because of our education, I think we both share an ability to translate very complex, incredibly difficult things that are really hard to understand for ordinary people into plain language, because that's what we have to do to get elected. You can't get elected by putting forward complicated scientific ideas. You can get elected by connecting with people and telling them what it is that you think you can do to make their lives better or help them make their own lives better. So, having said that, and I'm certainly going to let Governor Geringer speak for himself, but my technique always was to hear from experts, to ask them really hard questions, partly because you might not understand, and partly because sometimes data doesn't do it, and just following data blindly does not give you the solution. So you've got to ask practical, real world questions, and then you've got to go to the press and explain it in plain language, because that is the intermediary. And you've got to do it in small amounts. This stuff is very, very complex. What epistemics does is unbelievably complicated, but it's absolutely necessary, and it makes enormous sense. So it's just vital to have a way of translating this very complicated model to what ordinary people can understand. Without the complicated models, you can't succeed, but you also can't succeed unless ordinary people think it makes some sense to them.
Great points. And Governor, I know that whether it's health or energy or life sciences, your appreciation for data as a powerful tool, or data with value, i.e. information, is going to inform a lot of the constituency, and I couldn't agree more. And Governor Geringer, I know we've talked about storytelling and the importance of it in any dialogue. Facts tell, stories sell. And if we have good facts or decent facts, stories can convey that message of hope, and also maybe, as I like to say, create a light bulb moment. Can you speak a little bit to your experience and your walkabout in life, that as technology evolves, there's hope, but there's also a constant need to educate and make sure people are getting good information?
I'd say it's hard to summarize it in a single concept, but one of the expectations of a leader, a governor in this case, is that the governor is well enough informed that the decisions that they're making can instill confidence. Howard talked about the essential nature of believability. You can't overwhelm people with something they can't understand, because then they will be suspicious. And if they're suspicious, they don't accept. And if they don't accept, they won't get vaccinated, as an example here. So, and you seldom have the luxury of time. One thing about academia and some of the major professions is they say, well, let's get statistically reliable before we make a decision. Well, time doesn't wait, and neither does a disaster. And in this case, it's a crisis. So even as we discuss something like vaccine distribution and the logistics and all, the environment is changing around us. We talk about everybody should wear a mask, yet there are mutations of the coronavirus that are occurring already that we don't even fully understand how they mutate or how they transmit. So you have to always be looking at not only the current situation, for say an incident commander or a governor, what is my current situation? Now, what do I need? What do I have? Well, that requires data or information, especially on the what do I need versus what do I have. There are gaps. Este, you mentioned that already. So I'd say information integration is number one for a governor to make a decision, and then preparing options. No one likes to be told, well, this is what you should do. The best thing you can do to a decision maker is to say, here is what we have ascertained from all the experts, and here are the trends that are out there, and here's the information we have right now, even though it's not everything. Here are probably the best options that you face right now, And if they want to, they can say, and we recommend this. But oftentimes leaders will say, well, I have some insights perhaps that you don't. So yes, I understand that you're recommending this approach, but I'm inclined to go this way. Now, let's talk about it. And then you test the strength of their conviction as to the one they may have recommended. But options are so essential. You don't just pick one and run with it. You may want to do that ultimately, but the public wants to know that you have considered other things, because when you go around and listen to people, and that's one of the keys, as Howard mentioned, you've got to communicate. The first thing I do is ask questions. They don't want to know my opinion so early on. They want to know if I know what they're thinking. And so it's very essential in any decision maker's position to ask questions so you know what your audience is thinking. I know in this particular response, many of the states, Wyoming included, and I think Howard, when you were governor, let's see, neither of us was governor in 2009, but we do remember avian flu and some of the others that were floating around at the time that we were in office. But the H1N1 flu episode and the vaccines that were being distributed back then, that provided quite a bit of a, if you will, for many of the states. And so the governors got together through the National Governors Associations and with informal discussions and started to put together their response plans, first to the whole COVID environment, and now especially with the vaccine distribution. So that coordination is a recognition that no matter the high expectation of the news media and the public that the federal government's going to do something, in the end, it's going to be state and local that makes anything happen. And the insights that you receive from those state government plans with the locals that participate, Wyoming has a rather centralized operation for public health. California doesn't. Everything is run out of the counties. Missouri's even yet more different. So you have to rely on the local capabilities that are in place and take advantage of them. So that's all part of situational awareness. And how do you adapt something like vaccine distribution to that? Information integration and options are probably where I would start, and then go from there.
No, that's a great point. And I think this idea of, I don't know where these are coming from, but my father used to say, show me a man or a woman without a plan, and I'll show you a man or a woman who plans to fail. And roadmaps don't sound sexy, but if we have a roadmap that is a constantly evolving one, and the collaboration with all levels of government, all levels of technology, we have to have a constant dialogue. So I appreciate that. I wrote down ask the right questions, have response plans. I'm going to go back to Este here. Este, precision public health, the use of technologies, for example, genomics, spatial analysis, big data in public health practice. Hearing a lot of this, again, with your expertise, and as well as Esri's capability to visualize with good information a picture that can help paint where we need to go. Can you speak a little bit about this concept of precision public health and how Esri itself has built that into its platform?
Sure. So where to start? I think we've seen this evolution on the medicine side, the healthcare side, go from treating a patient, which we all do the best that we can, to turning that patient more into a person, right? So we get to personalized medicine, where we start to consider patient preferences, what's going on in the rest of their life outside of their individual interactions with physicians. And so we went from regular patient care to personalized medicine, and then that evolved to precision medicine, where we were looking at the bench science behind medicine and treatments to make a deeper connection at the individual level. Like, this medicine will work for you based on your genetic code, right? That's the ultimate goal, is you want to get to that identity match between treatment and patient so that we know it'll work. Then that definition of precision medicine started to expand to include the environments in which people live and work and learn and play. And that's where I think there was sort of this translation and this idea that, hey, we can use this concept of precision in public health as well. And so it was actually coined by a colleague of mine in Australia, Taryn Weeramanthri, who thought about this And it really, in my view, has very spatial implications in that it's how we can take the idea of huge population health issues and focus them on very strategic and tailored responses in different geographies. Or we can follow an individual through their different environments to understand that collection of environmental positive and negative influences on health to ultimately figure out what they may be personally most at risk for. So it takes that concept of clinical care and precision clinical care out into the rest of a person's life.
No, thank you. And again, some of this terminology for our audience is you're going to need to go Google, Bing, or search on it, but that's a term that resonates. And in a world where we're constantly hearing about a new way of thinking, or precision medicine does it for people, it's about data helping us with actionable and applied intelligence. And I think the automation component with Esri is something that folks should be excited about and take advantage of. Dr. Burke, the framework for reconstructing epidemiological dynamics, also known as FRED. Can you speak to some of that amazing capability that is producing this visual of our country's map? So we're not going state by state, but now we can actually look at potentially impact across the masses.
So FRED is based on individuals. We simulate every person. We have a synthetic population of the entire US, every county, every town. So in there somewhere, there's a Don Burke and a Jane Burke, and they have about my age, and our household is the same size, and that synthetic Don Burke goes about his business and interacts with lots of others, and that we do that for everybody. And so by doing that, then but in computation, we can introduce an infectious disease and then watch how that may spread. And more importantly, what we can do is we can say, well, let's have that synthetic, in this case, let's have that synthetic Pete Saronis stay home instead of going about, and see what happens to his risk to getting an infectious disease and his family's risk. Or we can say, well, let's have him wear a mask and understand that if he wore a mask most of the time, what would happen? Or what would happen if everybody in his community wore the mask? What would the epidemic look like then? So by playing these out, we can ask these questions about if we did masks and if we stayed home and if we got the vaccine to everybody who needed it, how fast would the epidemic go away? Or will it come back? If the seasonality increases, if these effects of seasonal temperature and humidity and things like that, they're going to be pushing in the opposite direction at the same time the vaccine's pushing in one direction. How are those going to interact? And so we can at least go through and say, well, here's what we know, here's the best available information, and see what those possible futures might be. Yeah. That's what FRED can do.
Go ahead, Este, go ahead.
What Don's talking about is precision public health, right? I mean, it's a great example what FRED can do to show you exactly what it means to take a population, look at its specific actions in a specific problem, and see the local communities where that becomes an issue that you could intervene on and improve outcomes. So yeah. FRED's amazing for being able to do that.
Right. I have to give a shout out, and there is a story behind FRED and Mr. Rogers' Neighborhood that you can read about because it's pretty cool. Dr. Burke and Este, thank you. Governor Jim.
I was just going to follow up on FRED or Don, whichever one wants to pop up first. It would seem that scenario building would be an essential part of that, because as you start to surmise what's happening with the epidemiological modeling and the syndromic surveillance and all the things that go into that, you start to say, well, what if? And what if becomes a scenario? And then you pursue the scenario that has a greater likelihood or a lower risk than others. You can't find the perfect solution. So somewhere along the line, you have to have the ability to do scenario planning. And I'd interject at this point, if states aren't doing practice exercises right now on their distribution plan, they're going to have problems that they didn't anticipate. They should be practicing. They should be doing tabletops, if nothing else, especially on integration of information, like an incident commander does for a forest fire or emergency response does for a hurricane. But then you update those scenarios based on the latest additional data. And there's so many sources of data. Phone companies can let you know, if you're a health officer, where the greatest concentration of people are at a given time, because they're cell phones. They're not being tracked individually, but you can congregate information, and those are high risk areas. Just as you can tell when there's a traffic slowdown in the interstate ahead of you, it's the same thing. Companies like Google and others track cell phone location and then plot it on a map, and it's the where. Everything we do is somewhere. So where is kind of the beginning of all these things. But scenario planning, Don, I'd like you to at least address how you approach it, because when it comes to somebody like Howard, when he has to make a decision, both with a medical background and as a governor's responsibility, which scenario is most likely to work?
Yeah, so that's a great point. So we don't try to predict and say with accuracy, this is what's going to happen, because there are just too many other contingencies. There are too many things that could happen along the way. And so what you have to do instead is to say, well, what are the possible range of inputs? What could happen? What are the contingencies? And because of that, you play out scenarios. So, but instead of playing them out in tabletop exercises or in field exercises, you play them out in Silicon for your entire community ahead of time. You say, well, what would happen if, there's all of a sudden there is a movement against vaccines and it starts to spread? How will that influence things?
Mm-hmm.
And then you say, well, how can we change that? And if we do, what will that do to the subsequent course? Well, I don't know if that's going to happen, but we got to be ready for that kind of thing. And we've got to play through what are the possible outcomes. So the idea of using Fred or tools like it to do scenarios ahead of time, to think through so you're ready and can do these things in the field and in reality, that's one of the major uses of Fred.
So Governor Dean, do you have a comment? Because I have a question for you, but based on your background.
Let me just make a couple of comments about this. This is really interesting stuff. So here's the intersection of facts and sort of the art of politics. We're going to know what likely outcomes are, and they're going to be modeled, and they're going to be pretty good and pretty helpful. And we're going to know what happens if we open schools and where the teachers live and how that affects the infection rates and so forth and so on. Then you have to take into account human nature, which is a little more difficult. And one of the things our Governor Scott did, which I think helped him a lot, he understood Vermonters. They have this great saying about Vermonters, which is probably true about most Americans, that if you ask a Vermonter to do something for you, they'll do anything you ask. But if you tell a Vermonter to do something, they're not going to do it.
Remember that one.
Yeah,
I like that one. That's tweetable.
but the thing is, so you have to work with that, and so you've got this computer model that says if you don't wear a mask, this thing's going to spread 8 times faster in all kinds of different ways, and which is completely accurate. Now the question is, how do you slowly get people who don't want to be told what to do the things that they need to do to save their lives? And one thing we know doesn't work is scare tactics. It was very interesting to see when my kids were growing up, the drug epidemic was sort of just beginning in a big way, and we had DARE programs. The DARE programs, which were terrible, was when the local police officer went on and said their heads were going to fall off and they were going to end up in jail if they used drugs. The ones that were really good, which was when they could actually show movies or have people come in and talk about what happened to them when they used drugs, and that was 100 times more effective. So a lot of this, without the computer modeling, we can't do this. But without some translation to human nature, we can't do it either. And the terrible thing is you have to make some compromises oftentimes, and that you don't want to make on a scientific basis.
Well, that's a note for the audience. That wasn't a setup, because I was about to go to you, Governor Dean, with when I think of, and this is really for the group here, is the why should I care? What does this mean to me? We're hitting on this humanity component, how technology is not a problem. We know that. We like to blame it, but it's usually not the problem. How we interpret, whether it's prescriptive, descriptive, predictive analytics. Fred and Esri together are doing amazing work, and God willing, we again curb this. But When you Google like things to think about, and for Governor Dean, meeting sub-zero storage requirements, prioritizing vulnerable communities, assuring equity across counties and districts and municipalities. You and Governor Geringer are there with this base of here's how this will impact you. How are you engaging in that dialogue, or what recommendations do you give to folks in those positions to give that everything's going to be okay, we're doing our best, but there are things that you need to, have calls to action and respond
Some
to.
stuff is not negotiable. I mean, you can't, there's going to be a hierarchy of people that need this, and it's not negotiable. I mean, caregivers are going to have to be very high up in the list, and other people who have high exposure and high risk are going to have to be very high up in the list. That's not negotiable. I mean, there can be a big argument about how come my mother-in-law who has diabetes isn't on top of the, higher up on the list than some other thing. That's not negotiable. That can't be. Because there's going to have to be an order, and that's not a political decision. That's a first of all, it's a human condition, but it's also a disease spreading limitation. But there are things that are negotiable, and that you have to kind of work with the public's prejudices. One of the things that can be incredibly helpful is media. And again, the most effective, this is why evening news shows about somebody who lost their father are horrible, in the sense that, oh my God, why do we have to watch this? But you have to watch it because that makes it real to a lot of people for which this is not real. I mean, the honest truth about this is that I don't know what the fatality rate is, but and obviously varies greatly by age. But if you take all age groups, I'm guessing the fatality rate is 1% or less. If I'm going to have Este or Dr. Burke correct me on this, because I don't know the exact number. So if I'm sitting here and saying, well, for 1%, I'm damn well not going to wear a mask. But then you see all it takes is one story about some terrible tragedy that happened. All of a sudden that 1% gets up to 50 in the mind of the person who's watching the story. And that stuff matters. So there's a lot of this, still a lot of this that is not scientific. But if you don't start off with the scientific, you're just going to be swimming around meaninglessly and not have any direction at all.
Well stated. And I'm going to ask Este, Este at Esri, where it's not just a mapping company, but the need for high quality, authoritative, near real time data sharing, right? And believing the authenticity or the provenance of that data. Can you talk a little bit about how important that is when we're quoting metrics in the media and so forth, to have that authoritative data?
Yes. I mean, I think maybe the best example of how important it is looking at the Johns Hopkins data. I mean, they took it upon themselves to use Esri software to create a dashboard very early on in the pandemic. And the most important thing to them in the beginning of their effort was that whatever we do, we're going to share the information. And we helped them. They were sharing through GitHub. We also helped them to share it through our platform. And that literally led to thousands of organizations, governments at every level, and different kinds of businesses pulling in that data so that they could create their own localized view dashboards with things that were important to them and to their populations, and made them able to have that situational awareness that Governor Jim's talking about, and make decisions. So to see the options, I think. So that's really important. But we have this real challenge when it comes to data for health, because there's a lot of concern about privacy and protections, rightly so, obviously. This data is all aggregated, right? We don't see anything really lower than a county level, but it still makes people nervous. And so there's been a tendency to pull back from sharing data, which is why I think an organization like Johns Hopkins built a team that could pull the data where we were falling behind in our country and other countries around the world, and being able to have a cogent national picture of what's going on. It really took another organization to pull it all together, start the conversation, and kind of teach the rest of us that it's okay to do that with health related data, but it's still public health data. It's not personally identifiable. So the data sharing enables everything. It's hugely important, but I understand the complexities.
Yeah, the dashboard is a term that I think most technologists from sea level to ground level to whatever says, hey, I'm looking at something, you want to believe that the data is accurate and so forth. Thank you, Este. Dr. Burke, coming back to epistemics and your passion and your history and working with folks at that level, at the top, working inside the Beltway. Can you speak to some of what you are optimistic about when it comes to having the access to information that can help, whether it is predict or say, hey, here's what we think is going to happen. What are some of the capabilities that in partnership with Esri, the epistemics team has helped develop or provide in terms of insight?
So we are real believers in the value of modeling of possible futures. That the philosopher Kierkegaard said, we live forward, but we understand backward, meaning that you use data from your experience and data that's collected to think into the future, to understand what could happen. We're all modelers. Everybody is a modeler. It's just sometimes we model in our heads. Sometimes the models are not really explicit computational models. And what we're trying to do is to help take these complicated pieces of information and make them explicit. To take the same things that are going on inside your head now when you face complicated data, but put it in a computational way that allows you to check your reality. How am I representing this particular component of the social interaction or the effect of vaccines or the effect of climate? But to do that in a way where you put it down in with numbers and quantitation and you do your best. You're never going to be perfect, but this forces you to be explicit. So the whole idea of taking data streams and turning them into processes where the thought process is more explicit than just thinking about it in your head. Thinking about it in your head is fine. We've done pretty well as a species up until now. But I think we can do a little better. The model's not going to replace thinking. The model is not going to be the way that the decision is made. It's going to be a help to think through, as the governor said, as scenarios of how do we think about possible futures and what do we really know. So I think that's a powerful tool. I really think that as data becomes more and more available, then we can put it through these computational tools of representing how we think about complex problems, and then have the data come out and look at it with tools like what Esri has that allow us to see it in space and time and understand it because of that. I am optimistic that this is going to help thinking about these complicated health and social dynamics problems.
Yeah, Governor, go ahead, Este.
Sorry, I get so interested.
Go for it.
I'm just thinking about what you're saying, Don, and we are all modelers in our head, but I recall a fact that just sort of blew me away several years ago, that humans ultimately, as we make decisions, we make choices, we're really only able to consider 4 or 5 facts at any one time and balance those out. And to me, that speaks to the need for technologies like Esri and Fred, because we can build the complexity of current daily living into those models, which consumes well more than 4 or 5 facts at any one time, which I guess, Pete, gets to your previous question about big data and what that means and putting it into a model like Fred. So I think, although we could do some of this in our head, I would vote for technology in this case.
Well,
I'm told that governors can hold 7 or 8 ideas in their head at a time.
Well,
we are in an elite group.
well, let's go to these wonderful storytellers for a minute. Governor Dean and Governor Geringer, you do have a voice, and folks come to hear you speak, and past and present. And when you hear about how technology, in the case of with Dr. Burke and Dr. Este, talk about this collaboration. I mean, these are companies and thought leaders coming together. They're working with national laboratories in our country, and there's a lot of research and development. I keep coming back to that messaging and the trust and the belief that there is hope. but this dependence on technology isn't something we should fear. So hearing a lot of this, where is the optimism, the messages, the conversations you're having with your constituency, the human person, the public? Are you hearing folks believing that technology is going to help get us somewhere?
Was that for Howard?
Oh, that was for either. I'm sorry, Governor Geringer. We'll start with you. Sorry about that.
Well, I have a saying because I worked with the application of technology for a long time. Just as a little bit of a flashback, when the Winter Olympics were being held in Salt Lake City, there was a flu outbreak that was cooking at the time. And I was pushing our health department rather strenuously to do information integration and to have exchange of data, and they were using fax machines. So that was technology. That wasn't the most current technology, but it's what they all had. Not everyone had it. My admonition, whether it's for education or healthcare or energy patch or whatever it might be, is start with the issue first and technology last. If you start with technology, you will try to mold everything to it, and it should be the other way around. What tools do we have that can enhance our ability to think strategically? Because when it comes to something like the distribution of the COVID vaccine, there's an awful lot of variables in there. If it's going to be the Pfizer vaccine that becomes the most prominent early on, and it has to be maintained at this incredibly low temperature, nobody can imagine minus 70 Celsius or minus 94 Fahrenheit. You just can't imagine that. It's just damn cold. That's all you know. But then when you don't use it right out of the freezer, you have to thaw it to a certain point, then you have to dilute it, then you have to administer it within a certain period of time. And some of those batches are, so there's all these variables that will enter into our ability to do an effective job of vaccinating the public. So being able to assemble a technology that seeks the information that will be most strategic in nature, and Johns Hopkins has done they don't just give you a situation awareness worldwide, they highlight data that can make you think about what's coming up next. And I think that's the key to what technology can enable, is that it helps us individually, not just as governors, to do a little bit more strategic thinking rather than just say, well, I remember when, and this is what we did. There's too much of an inclination to base it on prior experience or intuition, and facts can be too confusing. So I'm just going to go by what worked before. There has to be a way for people to understand the strategic nature of information systems.
Thank you. Governor Dean, if you have a comment on that, I have a question for you that might be in the context of that.
Point I'd make is to underline Jim's point about not letting the technology guide your thinking. Let your thinking guide what you need the technology for. There are gazillions of applications and instances where technology has been introduced, say, to a hospital, and the whole hospital has reoriented itself, and the thing gets so complicated that nobody can figure out what to do. And it's just, we all do it. We get captivated and we put the horse before the cart before the horse. And that is really an important point. And I'm glad you said it, because I wouldn't have thought of it.
Well, you hit on this world that is cloud, and it's the volume, velocity, variety, and veracity of data that it's, wow, we have so much of it. How do we make sense of it? And I was going to stick here with maybe Governor Dean, the policymakers facing important consequence decisions with, it's not perfect information. Can you give an example or talk about how you understand that, but you still bring hope to folks saying, look, we need technology, we need great thinkers like Este and Dr. Burke, but there's still there's a lot of unknown. And while technology is not the problem, we have to depend on it. Do you feel that you bear that burden of that policy is important, but we don't have all the answers?
Well, that's always going to be the case. We wouldn't be worried about policy if we had all the answers. So, yeah, I think where we need to, but we do need to understand that the technology never leads the solution. The solution appears, and then you figure out technically, because you have all this technology, especially people who are really good at technology, like these two. they build to suit the problem rather than, oh, here's a technology, let's find a problem that we can fix with it. And that's really critical. I mean, I used to have this saying about technology in government that it would cost twice as much as they said it was going to cost. It took twice as long to put it in, and then you have to do it twice, which happened to me in the tax department. And it was terrible. We ended up pulling the whole system out and doing it all over again. I mean, and that, if your goal is let's put technology into everything, you're going to do that. If your goal is we have a problem, and then you go to the tech people and say, how do we solve this problem? You don't get something off the shelf that is built for them, not for you. And that is really, really important.
You're speaking to the scalability and adaptability. And I think I always use it as my printer. I buy a printer and the new version of it came out, a week later. And I'm like, can I get credit for that? So let me bump it back to Este here and Don. This scalability, whether it's with Esri or with Fred, being able to adapt to the governor's point, which is, there's going to be a new problem tomorrow. Can you speak to the, dealing with the problem of today, but then somebody coming in with maybe it's a vaccine showing some mutation. It's like, now we have to pivot. Do you find that your technology and solutions are adapting quickly?
Well, of course, I'm going to say yes. But let me give you the reason behind that. The intention of our technology is to make it configurable. And the whole idea is that you should be able to use certain tools over and over again for multiple different purposes. So this idea of prioritizing populations for the vaccine delivery. Well, thinking about populations and demographics are the same things that you use in multiple kinds of health problems and problems in other sectors as well. Where are the gaps? Where are the worst outcomes, whether it's financial, health, or otherwise? So we try to create tools that somebody can learn and then configure so that they can quickly adapt to the next problem. They don't have to customize or build a new solution. They just take the tools they have and tweak them a little bit. So that makes it, rather than, I would call that extendable, probably. And in terms of scalability, I think to me that usually speaks to infrastructure and that capability. And I think this pandemic has taught us a lot about what it means to scale and what it means to have a viral application. And I'll go back to mention one of my favorite statistics from the Johns Hopkins University dashboard. Since everybody is using it, at a peak, we saw 4.5 billion requests for that information per day. It is the most viral map-based application in history. And people, anybody who tries it can see that they can get it. It works quickly. So scalability, extendability, I think any good technology has those traits in common.
Dr. Burke, technology aside, some of the excitement, what are some realities or light bulb moments that are happening in the world of epistemics and Fred?
So one of the important developments in this epidemic is lots of people, many scientists are now trying to turn their skills to model it, to predict it, to forecast it. There are a lot of very smart, very capable people who have been developing models that are, and this is hard. As Governor Dean said, that when you put the human element in it, all bets go out the window for a while until you start to see the patterns. But lots of people have been developing very good models, but what we tried to do is to say we don't need a model. What we need is a platform that allows you to address problems as they come along. So I have been working on computational modeling for decades, and I finally realized that this is like a lot of other technologies. Is that what you need is the capability to build something which is flexible, that allows people to solve their own problem, to give them the tool to help them think through their own problem. So that's what we tried to do with Fred, is to create a platform, a simple way for them to create their own models, to address their own problems, and we think that's what's really going to be useful about this approach. It isn't that the technology drives the work; it's that the work drives the specific approach.
And Governor Geringer, if pouring that hat that you have, there was a quote I found. The challenge of vaccine development is matched by the challenge of vaccine distribution. And we've talked a bit about that today. Although a vaccine is not yet available, lessons learned from the acquisition and distribution of COVID-19 diagnostics and therapeutics suggest that governors may want to begin addressing the challenges of mass distribution before its arrival. Do you have, or have you experienced something, maybe not in this case a pandemic, but getting that out to the constituencies as we talked about? There's work to be done, and there's an onus on the individual to be prepared for change that we aren't sure what will the impact be.
Well, Don talked about having a platform. I would characterize it in a little different way. Esri has a platform, one of the well, it's called GIS, but then they have a concept called the hub, which really is extraordinary in integrating actions by different people and information. What the governors do is they take each other's good ideas. We call it stealing, but it's just a way to take credit for somebody else's intellect. And they're doing a lot of that right now. And public health departments at more local jurisdictions, they have their exchange methodology, if you will, and the connectedness that we have. You mentioned the Internet of Things, Pete. There's an awful lot of exchange of ideas going on right now. So it's not going to be somebody developing a plan in isolation, a technology in isolation, and then trying to see if it works. There's going to be a lot of tweaks all along the way. As a good idea pops up, somebody's going to adapt it to their own situation. They're going to try it out. They're going to share that. That's going on continuously. Governor Dean and I were exchanging statistical information about the size of our states and the size of our populations. People in the big cities are wondering, well, what do they have? What do they know about our situation? There are many similarities. Access to healthcare can be just as isolated in Kansas City or Denver or wherever it might be, as it could be out in the plains of Wyoming, where there's only one person per square mile. That access has to be dealt with somehow. We all learned after schools were canceled and put online that not everybody is connected and has the ability to connect. So how do we disseminate information about vaccine distribution so we target the right populations and they all are aware of where they can be vaccinated? That connectivity is lacking in many areas, and it's just as prevalent in the big cities as it is in the remote plains someplace. So these are problems that the governors are trying to deal with as they're making their decisions and putting their plans in place. I had a chance to review a few of them online, and they're all stamped interim or draft, because they want to be able to say, yeah, well, it was just draft. I know we made that mistake, but it was just a draft, that way you can take credit for the good parts that were there and just say, well, that hasn't been updated yet. And they have a little log up in the front that says, here's where we're going to put the updates if we ever get there. So that idea of taking good information that someone else has already piloted, adapting it to your situation and improving on it. And it's that improvement that makes a big difference. Everything that Esri has done has been stimulated in many ways by the users of Esri's technology. They come up with ideas, somebody else says, aha, I can go on beyond that. And when they share and exchange and they build and they improve, the whole system gets better. And when it comes to something like, well, okay, we want to target all the vulnerable population early on, or the healthcare workers and the essential workers, we've got to track those people. We are going to collect personal information, and it has to be used in order to be effective. And there might be some people who say, I'm not going to let you store my data. Well, every time you went to the pharmacy or you went to the doctor, you already gave them a whole lot of that same information.
It's out there. It's out there, right, Governor?
It's out there. I just want to be assured that it's going to be used appropriately. So being able to recall somebody for their second dose, or all of a sudden you discover that at one particular distribution location, there was a bad batch, or it was allowed to sit in the open too long, or something like that. Anyway, there's an anomaly that needs to be reported. Well, you need to know who got that vaccine, and you better know quickly. And if you didn't gather that personal information, your mortality might have just gone up. So those are things that have to be conveyed to the public in a way that they develop confidence in them. And one of the best ways is word of mouth. When people believe that something is going to work, they share that information with somebody else. But as Mark Twain said, rumor is halfway around the world before truth gets his shoes tied. And you have to deal with that as well.
Well, we're gonna thank you, and that's a awesome parting shot, which we'll get to here in a minute. But Governor Dean, you're a globetrotter. You're recognized globally. It's not just healthcare; it's energy, as we mentioned. It's life sciences. It's childhood development. And can you just maybe give a perspective or provide one for the audience on what you're seeing, hearing, or you mentioned lessons learned? What's going on in other parts of the world that makes you feel good about we are getting around the corner on this pandemic?
It very, very much depends on what's going on. And I don't feel like we're getting around the corner other than the vaccine developments. As I said, I was on this call earlier with some people from around the world in South Africa and so forth. Their situation is much different. The idea that we're going to get most Africans who live in very remote places vaccinated is going to be incredibly difficult. I mean, we can't do this with polio, and the polio vaccine has been around for more than half a century. And so this is going to be incredibly hard. And of course, the storage problem of the low temperature is going to be, it make it impossible in a lot of places like that. The Chinese will be very organized. The question is, does their vaccine work? We don't know that yet. There was some question in Brazil where they're using it about how effective it is. And I don't know all the details, and that's not my specialty anyway. But, and Europe is seeing the same kind of rates we are and going through lockdown. And the second time in lockdown is meeting the same kind of resistance that it does in the United States. People just have had enough. And so right now it's pretty difficult. I think one of the reasons we talk about vaccines, we hope that's going to change the equation. But right now the equation isn't changed, and we're relying on things that harm the economy and put people out of business. But the alternative is to have a huge outbreak and overwhelm our medical systems so they become no longer functional, which nearly happened in New York when this first started.
Well, I
wish I could give you a happier prognosis.
No, but that's ground truth. No, Governor, ground truth.
I do think there is a happier prognosis, but not until we really do have a vaccine that we know works and we believe in. And then at that time, the reason these two data scientists are here is because they're the only way that we can prevent this from getting so out of hand that we can't function as a society, as a world society.
Governor Jim, were you about to say something?
No, I think because you have your time constraints, the only thing I would offer as a wrap up is I hope everybody adopts the attitude that there's always something I can do to help it be better for someone else. So if we all take that attitude that I have a part, no matter how small, I'll do my part, and in the aggregate we'll get much better, whether you be a scientist, a doctor, or just somebody who's trying to help your neighbor.
Amen to that. And you took the first parting shot slot, so good for you. I was going to let you tie it up for us, but we'll start with you. Let's pivot up to Este. Este, your parting shots. What do you want to leave with the audience?
I think that geography is a part of every data point that we have, and to remember that you can use that to develop strategies, to make better plans, to gain situational awareness. And if that will help you solve the challenge at hand, we'd be here to help you do that.
Thank you. Dr. Burke?
Yeah, I think that we need to get a better ways to understand how this is going to play out in the future. And any way we can do that by sharing data, visualizing data, simulating the processes. And if we can do that, that at least gives us a chance to think through what our options are going to be and what our potential for controlling the epidemic is going to be. This is a real challenge for all of us, but I think we're working hard on trying to develop some of these tools and platforms that are going to at least make our decision making a little better.
Thank you, and we'll share some information with our audience of how to reach out to you and the good folks at Epistemics, as well as Esri and you too, Este. Governor Dean, parting shot.
No, just the only parting shot I have is remain optimistic. We've come through worse as a species, and we'll come through this.
Well,
Well, we're living in unprecedented times, as people say, and we hear we have challenges that we've never undertaken or we're dealing with as we go. But I'm confident you folks today helped make me feel a little bit better about it. I know some of you, but I appreciate your insights. I want to thank each of you for your time and attention, your change agents, your thought leaders, your impactful influencers in our world. And I enjoyed this time together, so thank you.
Thank you.
Great, thank you.